Okay, I think we'll go ahead and get started. Good afternoon, everybody, and thank you for joining today's webinar on coping with the ongoing COVID-19 crisis. I'm Catherine Rafelson. I'm SID-Washington president. Many of you were on our first webinar on this topic, which took place exactly 2 weeks ago today, and so much has changed since then. So we wanted to reconvene and provide an update and take questions as we all try to figure out what to do on so many levels in what is really an unprecedented situation. We've got just shy of 100 people and counting. I think we're just over 100 now joining this webinar. And as I said a few minutes ago, we're really grateful to all of you for joining on short notice. I know everybody's schedules are going nuts right now as we all adjust to the situation. We've asked the speakers who joined us last time to participate again, to follow up on their comments, to tell us what's changed. I know that many of you in the audience were on our webinar last time. Many of you were not. The people that are in the audience, I think some of you, those who are online, can probably see who has joined, represent the wide range of organizations that our members represent, and our speakers also represent the many sectors of development. So I'm grateful to have today as our speakers Sarah Helmstadter, who is Vice President of Human Resources at DAI and a member of the SID-Washington board who helped to organize today's discussion. We also have Jay Knott, who is also a SID-Washington board member and Chief Business Officer at Apt Associates. We have Laura Kazard, Deputy COO from FHI 360, Susan Corsini, Director of Talent Management and Operations at the Panagora Group, Anna Slother, Executive Vice President at Chemonics, and Christine Tsao, President and CEO of Humentum. We are recording this call and we'll post the link to it on our website and YouTube channel afterwards. And so I'd like to ask those who have joined online to introduce yourselves using our chat feature by stating your name and organization and title if you like. I think that's interesting for everybody to see. You can also use the chat feature to ask questions during the webinar. We will be doing Q&A at the end, and we'll do our best to answer as many questions as we can at that point. If your question is for a specific speaker, please indicate that in the question. We'll also do a couple of polls during this webinar using questions that we received from some of you ahead of time, and also some that we received during chat during the webinar. Those joining online will be able to respond to the polls online, and we'll read the results to you right away. Everyone except our speakers is muted, so please use the chat feature to ask questions and make comments. We're going to start with our speakers providing updates on what they and their organizations are doing to cope with COVID-19, and we'll have Q&A at the end. But first, I'd like to start with our first poll, which is based on one question we've received from many of you. Is your organization requiring staff to work from home? Those of you joining us online, you should see the poll and you can fill it out and submit it, and we'll give you the results in a bit. And with that, I would like to introduce our first speaker, Sarah, so that she can set the stage for our discussion. Okay. Sarah.
Thank you, Catherine, and thank you, SID, for organizing this second webinar. Just as a plug for SID, this is what I really think is so valuable about the organization, the ability to convene implementing partners so that we can share information, collaborate, cooperate, and really as an industry develop, top value, deliver top value to our beneficiaries and our clients. So thank you very much. This is extremely useful gathering. I know it'll be a good discussion. So what has changed in the last couple of weeks? I guess, the two big things directly related to our industry. One is that WHO declared COVID-19 a pandemic. we knew we were all going in that direction, but the declaration seems significant. And then as a flow down, number two, we've started seeing in our industry guidance coming out of State Department, USAID, really mission by mission on departures of people who are at high risk of complications from COVID-19 or departures of dependents. And it really is going, as would make sense, mission by mission based on the country situation, and in some cases, the project situation. So, you know, I would like to just give an overview of like some of the many challenges that I think we are all facing, especially in this international development space. And those challenges all revolve around and are driven by uncertainty. And I think it's the uncertainty around the trajectory of the virus. We don't know how much more it's going to spread, how long this is all going to last. Uncertainty around our ability to implement our projects in some cases. Uncertainty around revenue, you know, all of revenue forecasting is certainly under the microscope at this point, and in some cases that uncertainty translates, you know, for our smaller partners into uncertainty of staying in business, uncertainty of the security situation if you know, this continues on for months at a time and we start seeing shortages and civil unrest in the countries in which we're operating, you know, how is that going to impact us? And then obviously uncertainty around how we continue to operate while keeping our staff safe. So that's really, I think, the biggest challenge that most of us is facing is, how do we continue to deliver on our mission of, you know, making the world a better place and delivering impact in countries around the world? How do we continue to deliver on that mission while at the same time keeping our staff safe and healthy? You know, I think many of us are used to operating in unstable environments and uncertain environments, but this is the first time that we've ever operated during a pandemic. And I think it's that uncertainty around what this pandemic means and the fear that is being driven by that pandemic and uncertainty is what's new to many of us, most of us. So I'd like to just focus on, you know, delivering good development while at the same time taking care of staff, because that's when it comes down to that lowest, most practical level, that's the big challenge for us. So it's taking care of staff in the field, both international and host country national staff, as well as taking care of staff in our home offices. And for us, really at DAI, the biggest challenge has really been sort of finding that balance between what is reasonable and sensible, while at the same time addressing staff concerns over safety, you know, in this very fearful environment. And in many cases, you know, we see a near panic level of concern. So, you know, what have we been doing on that? You know, since January, we have really focused on following public health authority guidance at the international, regional, and local level. So that is the country level in you know, on our projects, and then here in the greater DC area, it's Maryland Department of Public Health, or Virginia Department of Public Health, DC Department of Public Health. So following the guidance of those authorities, whether it's about exposure risk or you know, sickness or basic prevention. And we felt like this was a objective and a good public health practice to follow that guidance. And what we have found is it's hard to communicate out on that without staff and at the same time have our staff feel that we really have their best interests in mind, because often they're wanting to go ahead in a perhaps even more conservative route that is not necessarily in their best interests. So many of us, in the industry, including DAI, took steps last week or slightly ahead of public health authority guidance to go to remote work. And in some cases, it's, remote work, you cannot come into the office. In DAI's case, it's we encourage all home office staff in a number of countries around the world, depending on circumstances, to stay out of the office, stay off public transportation, and work from home. But we're not closing our offices. So if people need to come in for something, they can come in. But they should not use public transport to come into the office, and they should be practicing heightened, hygiene measures. Then we also have limited travel. We had always, from the beginning, restricted travel to CDC level 3 countries. And as of last week, we have really encouraged everybody to look at whether or not travel is necessary or could be even productive. So we're not going by a definition of business critical travel, but really it's more look at where you're going, look at the situation in the country to which you are traveling and the countries through which you may be transiting, and think about, are you going to be able to have the meetings that you need to have, or are various, government, private sector, partner organizations shut down? Are you going to be able to move around the way you need to move around? Are you at risk of getting stuck somewhere or quarantined somewhere? So really look at all of those factors and use, your best international development good sense to decide whether or not that travel makes sense. Then coming back to staff, managing expectations of staff, which has really been, I think, the trickiest, most delicate issue. In the home office, it's been difficult, and then even more difficult in the field where we have people living in countries that have weak healthcare systems, and they think that it will be best for them to get out immediately. And, we have some staff who are like, no, we're fine. We can continue to deliver impact here. The embassies are open. They're not evacuating. And, we can be productive and we're comfortable staying. We have other staff who are extremely nervous and who want to know whether or not they can be evacuated, whether they should just get out of the country immediately. And in many cases, it's going to be safer for those staff to stay where they are rather than to travel and go through hubs and, put themselves more at risk of catching the virus. And so it's that balance between what is sensible and reasonable and what keeps staff safe that has been really the most difficult, and to be completely honest with this community, the most difficult from a staff management and a kind of PR, almost like a PR perspective to manage. So I wanted to just share those thoughts, and I would love to hear what others have to say.
Thank you so much, Sarah. I wanted to show the the results from poll number 1. Poll number 1, to refresh your memory, is your organization requiring staff to work from home? 77% yes, 16% no, 6% we all worked remotely before COVID-19, and that's it for that poll. But thank you again, Sarah. Very, very, very helpful. I now want to introduce Jay Knott. Jay, over to you.
Thank you. So just one thing to add to Sarah's very insightful comments is with regard to the question of evacuation, which people are asking for, you need to distinguish between is it a voluntary departure or is it a situation which is really requiring evacuation. Most of us operate with some sort of ISOS sort of coverage. I think what most people will find if you review IOS's policy is that, again, as Sarah mentioned, not only is it safer to stay there, but in fact, where the treatment, the normal treatment for COVID-19 is really going to be something like if you had the flu, which is to stay home and self-isolate, not necessarily evacuate unless there are underlying conditions which would necessitate in a situation where appropriate treatment is not available at site, then in fact, evacuation might be appropriate. Even then, though, most IOS evacuations are done aboard commercial flights. And so all of the normal travel and transportation restrictions that we see going up around the world are also going to apply in those situations. So, you know, rushing to evacuation is simply not an option, I think, in most cases. So what I really wanted to focus on is really looking at local operations and business continuity and how organizations like ours are endeavoring to best treat our local or in-country staff. So we quickly realized when we thought about business continuity that we weren't in a situation where you could craft one business continuity plan. In essence, there's one we have for our US offices, and then there are dozens of continuity plans which we are in the process of crafting for international operations. You can follow, I think, a common business continuity plan outline, and there are many of them out there. But in essence, we're all going to be reacting to specific local conditions, specific actions that national public health authorities are going to make for reasons that they make them, and evolving along the track of where these countries are, not if, but when they deal with the pandemic, because it's coming everywhere, we know that, and testing, of course, is uneven. So I thought I'd really structure my remarks around just taking as a for instance, 3 different countries, taking 3 different sort of postures at this point, and how sort of the thought process we're going through in terms of how we deal with those situations. Those countries are India, Jordan, and Mozambique. So in India, the government of New Delhi has essentially instituted or mandated remote work. And so that's an instance where we've followed along with that. We've taken steps to better enable our local staff to work remotely, whether it's having additional modems or SIM cards or what have you, in order to make that more possible. India is a place where at least our senior staff are more likely to be able to have a connectivity environment which allows them to do work remotely. We also have staff for whom that's not going to be as easy a possibility. And so we're going to have to talk about what work can get done in the situation, what work cannot get done. Part of our work in India involves data collection at the household level. And so again, in that sort of situation, we have to determine what work can get done remotely, what work can't get done, and then really develop a plan of adaptation, which we go and discuss with our client, USAID or Gates or Packard or whoever it is. But I would really stress that one, planning is important, but also communication with the client is important before you go and take on additional costs and institute changes to your work, which makes sense, but haven't yet or haven't yet been accommodated into a contract modification or whatever is going to need to be put in place in order to protect your underlying business operations. So that's a country like India. Let's take a country like Jordan. Jordan essentially is going to be shutting down tomorrow. You know, the only exceptions are bakeries, pharmacies, sort of what the government is determining essential private sector business, which, by the way, apparently does not include banking. So the information we have from the Central Bank of Jordan is that while ATMs may be operational for some time, other operations for the next 2 weeks are essentially going to be shut down. So cash is king. And if you're operating in Jordan, you're going to have to undertake the same sort of adaptation plan of what can get done in a setting where the country is shutting down. Some work can get done remotely. Some other work can't get done. But in order to have any operations, you're either going to have to be operating on credit or you're going to have cash in place, some sort of cash management in place in order to continue operations, depending on what you do. So that requires a higher level of intervention from whatever your support system is internationally to provide support for an in-country team to continue to make sure that anxiety levels are managed, to take care of the care and feeding of your staff in a situation where, again, country shutting down for 2 weeks, high anxiety, people have families, and you need to have a balance about what's going on, and really think about how far is your company willing to go to protect your staff in a situation where, again, their work may not be possible for the next 2 weeks or the next 4 weeks or the next 3 months. And what are you going to do in terms of salary and other accommodations for your staff over the near term, medium term, and planning about the long term? So that's a country like Jordan, again, shutting down tomorrow. Then you take a country like Mozambique, where testing is essentially not going on. Mozambique has, diagnosed cases in the single digits. But of course, given what we know about Mozambique, we know that if it's anywhere, it's there. And the lack of testing, I think, as it does in the United States, prevents you from having a landscape of what's happening with the infection and the pandemic. In Mozambique, we're in a situation where part of what we do is work in health clinics across the country. Our personnel, many of them are in fact health professionals in health clinics where they're going to be encountering people in compromised situations. And you don't know whether it's malaria or TB or the flu or COVID-19. And so we're going to have to take measures now to ensure that, again, in a situation where we're not yet going to remote work, but we may soon, where we have personnel outside of Maputo going into health clinics across the country, we're essentially continuing operations until, in fact, we see a change in circumstances. So, but again, we need to do the planning, and we need to undertake to deal with, again, health professional staff who may be encountering people who are infected and coming down with symptoms in a situation where testing is not occurring, and what we're going to do when, in fact, those people are themselves infected. Obviously, again, remote work, obvious sort of answer for a central operations hub. But again, we're going to have to have a plan for what happens to implementation in a situation where implementation itself could be a vector, or you could be putting people in sort of harm's way without your knowledge. And so again, communication is really the key there. both with your staff, but also with the client so they understand what's going on. I think in most missions, what we're seeing is generally a regurgitation of the general guidance that came out from USAID last week with regards to how to communicate with them, what you do if there's a change in implementation or operations. I think as a community, we need to take advantage of that to communicate early and often. Again, even sort of near-term changes, which could have a long-term impact, need to be communicated so that, again, you don't get caught on the wrong end of your contract or cooperative agreement in terms of the costs that your company is going to be able to bear. So with that, I think I'll stop and let the next speaker take over.
Thank you, Jay. Really interesting. You know, from Sarah, I heard that uncertainty is a very major theme, which it most certainly is, and fear. From both of you, I'm hearing communication is key. And I'm remembering Jay's quote from last time, which I've used many times since, that the greatest obstacle to communication is the illusion that it has occurred. Did I get that right, Jay?
You named that tune.
Thanks. So, and really interesting to hear about the really varied circumstances around the world, and which just complicates things even more. I want to do our next poll before we go to our next speaker. And this question is, has your organization, waiting for the poll to come up. It should come up in a minute. Has your organization suspended all travel? And I'm not seeing the poll, so maybe we'll have to come back to it. Sorry about that. We'll come back to poll number 2, and we'll go ahead and start with you, Laura, Laura Kaiser from FHI 360.
Great. Thank you so much, Catherine. And thanks, Sarah and Jay, so much to think about and build upon. I had been asked to talk a little bit about how we handle our expat evacuations and helping our programs continue their work when leadership might be working from afar. I think that we're also, just building on what Jay said, we're all, moving rapidly to a more remote situation. So some of my remarks, I think, are relevant for when a leader has been transitioned out, or in many cases has not actually been able to return to post because of some of the many changes in air travel and restrictions. There's so many different external events that are affecting our ability to move people in time and space. But it was interesting to hear Jay's thoughts about, weighing the relative risks of, staying at post versus leaving. And I've been trying to gather some information. We have about 131 expat employees throughout the world with FHI 360. And I've been seeing lots of emails from people who are requesting to leave. And I had this impression in my own mind that we had really evacuated a large number of people. But when I actually looked at the numbers, it's just 13 as of this morning. So I think that guidance, the weighing of the risks has been effective, and perhaps either it's that or a commitment to the mission or a combination of both, but we have fewer people requesting to leave. One thing that FHI 360 did pretty early on, it was about mid last week, we sent out some guidance that we had developed specifically for what are the considerations and what's a more streamlined process that we could utilize to evacuate our expat community. We looked at it from an HR, a contracts, and more of an operations perspective. And so we did develop something that was geared to managers to help them weigh the risks and also think about the contractual considerations and what kinds of documentation would need to be obtained ahead of time, and what is the process that we could use that could be a little more rapid. So I'd be happy to share that guidance with the team, but I think it's been very helpful in getting our field-based staff to think about what they should put in place and plan for if they are going to undertake an evacuation. So the remarks I was going to make, really relate to both leading in a situation where someone might be in another, working from another office, and sometimes even another time zone. So for instance, we have a chief of party who is in our Philippines office, but was on home leave in Canada. Also somebody working from the US leading the efforts in Afghanistan. But it also could just be very relevant for remote work in generally. So I was trying to think of a framework, and I was going to utilize the 3 A's. So ensuring that there's access, that every person has what they need to carry on the work. The authority, so getting the right authorities at the right time and place so that we can operate in real time. And then I chose attitude, even though it's really more morale. How do we support our staff? How do we provide that ongoing leadership so that they can feel like we have their backs and that we're providing the information in a timely way and the support that they need. And really everything that we do has to be focused on ensuring that that local leadership can be effective, right? We don't want them out there calling all the shots and taking actions that will put the organization at risk, hence getting them guidance up front. On the other hand, sometimes decisions have to be made very rapidly. And so we want to make sure that we're delegating that authority effectively. So in terms of access, I mean, Jay mentioned a number of things that they are doing at APT. We have done a very extensive survey of our inventory of equipment to really identify everyone across the organization that could need equipment in the future if we go remote, that they would have access to that. We're looking at sort of pre-positioning dongles and other laptops and smartphones so that folks can be effective if they do move to a remote situation. And then looking at buying airtime as well, because a lot of our folks cannot afford home internet or access to the airtime that they need. We also have developed some remote work guidelines and tips that will be going out soon. So really trying to get people the access to the equipment that they need to carry on the work. The authority, getting the authorities, we've been looking at our banking operations to see, where we might have an account. I think it's going to be rare, but there may be accounts where we don't have a local signatory. We always try to have one, but sometimes staff leave and we haven't gotten it processed yet. So if an expat were to be a bank signatory, we want to take care of that. We want to think about the second in command and how can we support them if the chief of party is out of the office, and support them in their programmatic day-to-day decision making, making sure that wherever possible we can use electronic signatures like DocuSign to get things moving forward, and then providing that ongoing training and mentoring for folks who are holding down the fort. In terms of the attitude, really providing positive leadership and reassurance. I think during this time of uncertainty, people are fearful and they really need to hear from their leaders that, it's going to be okay, we're going to get through this. Obviously, you don't want to provide them with false promises, but they need to know that we're hearing their needs, that we are here to make decisions and create situations where they can take decisions, and that, as I said before, will be supportive of them, and that we're constantly assessing the situation as it changes, so being really agile. So we're doing a lot of things like daily check-ins with our regional offices. We've had, the regional offices are doing they're doing country by country town hall meetings with all staff, and that has proven to be very effective. We have some for our expat community specifically. We've created a listserv, and we're pushing out some messages to them. We're in the process of developing some self-care guidelines, yeah, I mean, we have a whole communication strategy that really identifies, you know, different target audiences, and we're trying wherever we can to push out guidance that folks can use just to preempt some of the risks and challenges that we think that we're headed towards. So I will stop there. I have a lot more other things, but I want to be mindful of the 3 to 5 minute limit. So thank you.
Thank you so much, Laura. Really helpful, concrete tips and information on what you're doing, and again, mentioning uncertainty and communications. I'm going to try that poll again to see if that came up. It didn't come up on my screen before. There it is. Hopefully you can all see it, those of you who are online. Has your organization suspended all travel? Yes, all work travel has been suspended. No, but travel is very limited, or no, or not applicable. So if you could fill that out, we'll read the results in a bit. So with that, I'd like to go to Susan Corsini from Panagora Group, representing small business for us. Over to you, Susan. Can anybody hear Susan?
No, unfortunately not.
Can you hear me?
Okay, now we can hear you, Susan. Great.
Sorry, I took my headset off. I was just saying that I'm sorry I don't have my video on, but it seems to be slowing down my audio. So one of the things that
Susan, we can't hear you again.
in this new work from home environment.
Are others having trouble hearing Susan?
Can you hear me?
You're coming in and out. Let's try it again, and if it doesn't work, we'll go to Anna and see if we can figure out your audio. Try it again. I can't hear you. Susan, we're going to go to Anna, and maybe we can figure it out. Anna Sluther, are you ready to roll? All right, we've got Anna from Chemonics. Yes.
Great. Yeah, I also didn't turn my camera on because it tends to mess with my system a little bit. Thanks everybody for taking the time to join the call today, as I will try not to repeat what others have said. I think it's also fair to say that none of us have all the answers yet either. We're all very much still figuring this out. I'm going to spend a couple of minutes, and I will, Catherine, try to cede a few minutes back because I know we want to have some time for Q&A, talking about some of the resources and kind of some of the practical how-tos that we're trying to work on getting out to our field teams. And actually, we are going to be posting this in response to this session so that all of you who are participating can have access to some of the guidance we've been sending out to our field teams. We have, starting, of course, also on the pandemic preparedness, we do have a specific annex that's specific for pandemics that has a phasing process as well as some very specific how-tos, including how to engage with the client on some of these conversations. We also created a very kind of more simple tool for chiefs of party and country directors to walk through the, you know, how to equip their offices for remote work. I think at this point we are expecting this will be a 2 to 3 month experience. and really how to start gathering a lot of that information and the questions we need to be asking around accessibility, how people can, security, how are we going to ensure, you know, inventory with some of this stuff during a time of extended office closures and the like. The other piece that we are really still pushing on and trying to sort through is really how to empower our chiefs of party and our business leaders on the ground to make the most timely decisions, to act and decide with our staff's health and safety at the first and foremost. But at the same time, how to also continue to deliver on some of those development goals that are in some of these programs going to become even more and more important as time goes on. A lot of that also includes collecting the next 3 months worth of large payments that people are expecting, and how we can be moving the money around more rapidly to be able to let people have that access to either petty cash, advances in payroll, or access to vendor payments if we need to start making those payments from other locations and that type of thing. Like I said, we are also trying to be reasonable and sensible with a lot of this, really trying to curtail any travel. We do have a few people, like others have mentioned, who are either in transit or we're on home leaves or that type of thing that we're still sorting out. But our message is really encouraging one of sheltering in place as much as possible to for containment purposes, and then really equipping our business leaders on the ground there to be empowered to make the decisions they need to make. So I will pause there and go ahead and pass it along.
Thank you so much, Anna, really helpful. Let's see if Susan, can we try you again? If it doesn't work, we'll move on, and but let's just give it another try. I'm not hearing Susan, so in the interest of time, if we could go to poll number 3. Can we put the poll number 3 up quickly? I'm not seeing poll number 3. Sorry, I think, oh, here we go. Poll number 3. What sort of programming, if any, would you like to see from SID-Washington regarding the COVID-19 issue? Check all that apply. Events, information sharing through our mail list, information sharing through Google Group listserv, resource page, or informal affinity group. And if you could take that poll while we go to our last speaker before we go to open Q&A, I'd like to introduce Christine South, CEO and President of Humentum. Christine, are you there?
I am here. Thanks very much. Yeah, so I wanted to speak a little bit about what Humentum has been doing and specifically focus on how we're working with USAID and DFID. So we have been holding weekly spot polls amongst members, and now we've expanded it outside of the Humentum member community to the larger sector to gauge the sector's greatest concerns as they evolve. And we share out the results of those spot polls on a weekly basis, but we are also convening weekly virtual roundtables. On Mondays, we have our senior executive roundtable, and on Thursdays we have a roundtable that is open to Humentum members for peer-to-peer learning and discussion and information sharing. We also have been doing a variety of webinars. This past week we had a webinar on remote working, and we've got a recording of that, I believe, posted for members. We've got resources for remote working posted for members as well. And next week, I think importantly for everybody on here, we are really turning our attention to business continuity planning, and we will be doing a webinar on Monday with the former Chief of Business Continuity Planning for the UN Secretariat. And she will be walking us through her experience, and we will be having a discussion around how our organizations are grappling with this. We have been in close touch with both USAID and DFID, and as I think everybody here knows, USAID sent out their guidance last week. DFID got their guidance out yesterday. That guidance has been really quite general, and in the case of USAID, really just referred us all to our CORs and AORs for their take on our questions. I think that ultimately that is probably going to result in more confusion because there may be a lack of continuity and consistency across those responses. And frankly, I am just glad I'm not a COR or an AOR right now because I know that they are going to be swamped by all these questions. So we are trying to really shore up the feedback loop with those donors. Tomorrow, USAID will be having a partners call. We have already collected comments and questions from the community that we've shared with USAID ahead of it, and we will be continuing to help facilitate the ongoing discussion with USAID around this, and we are trying to set up something similar with DFID for the coming weeks. We believe that it's really time for major donors to come together and try and align their approaches to risk and disruption. Right now, we're not seeing a whole lot of that, I think because frankly, all of us are scrambling to keep up. But the more that we work across the community and that we work across donors to really have consistent discussions around our challenges and issues, I think the better off we all will be in the long term. I also just wanted to let people know that as of March 30th, we are making our course on Is Your USAID Spending Allowable? Available online, and it's very discounted. It's open to member and non-member. It is an online course that covers cost principles within regulations and that will help support program teams assessing any extraordinary costs and allowability so that they can have better conversations with their AOR and COR around these costs. So I really recommend that. We can share more information. We'll be sharing that on our website as well. It's an online 2-week course. It's facilitated, but you can work at your own pace. So I think as we are all really turning our attention to business continuity and to how we are managing these unforeseen costs and delays, hopefully that'll be a resource that'll be useful both to the Humentum community, but also more broadly. So those are some of the things that we're doing. We will certainly be staying in touch with all of you. And as always, our Humentum Connect platform is available to members for active, ongoing communities of practice and discussion as well. So thank you, everybody, and wishing us all good luck. Over to you.
Thank you, Christine. I wanted to just quickly give you the results of poll number 2, which I had, but they seem to have disappeared from, sorry about that. We're having trouble getting the poll results up. I'll have to get back to poll number 2. There were a number of comments about USAID, and I wanted to mention that we do have Richard Parker, who heads up Legislative and Public Affairs for USAID webinar right now, and Richard may want to say a word or two. I know that they have their call tomorrow at 10, which I believe most of you or all of you should know about. We sent out information about that. If anybody has questions specifically for USAID, we can quickly ask Richard now. But Richard, do you have any general comments you want to make or anything you want to say about tomorrow's call? I'm not hearing Richard. So let me just quickly give you the results of poll number 2. Has your organization suspended all travel? 57% yes, 39% no, and travel very limited 4%. We're going to go ahead and take some Q&A from the audience. We have a number of questions that came in, so I'm going to do as many as I can in our remaining time. I am also hearing from Richard that he's having trouble speaking. Richard, you may be muted. We can unmute you, or you should be able to see a way to unmute. Well, while we figure that out, question number 1. for Jay, regarding India, can you use cell phone technology for data collection?
In some cases, yes, you can. You can use tablets or whatever technology is available, but it depends on the situation. And with regards to how we adapt to the pandemic, it's about whether the data collection can be done in a way that's safe. And so we're being very careful about ensuring that both for our data collectors as well as for subjects with whom we're interviewing, that our method is safe. And so while remote technology is used on a regular basis for that, in some cases, we may have to shift our methodology and do phone surveys or some other adaptation, which we'll have to have approved in order to go forward.
Great, thank you, Jay. Another question we had, does anyone have specific guidance for program managers working in clinical settings, HIV, TB, RMN, CH, nutrition?
So again, for working in clinical settings, particularly with the infectious diseases that were mentioned, you should already have protocols for staff who are working in those settings. Presumably, they're health professionals and are practicing those protocols on a normal basis. For work, so again, with the assumption that we're going to be seeing COVID-19 in the clinics in which we are working, we would need to adopt WHO, CDC protocols for working in clinical settings under those circumstances. So again, it may be an addition to the protocols you're already practicing, but presumably you already have professionals who are practiced at instituting those protocols at the current time.
Right, and that was from me. This is Laura. I think what we were hoping is that, you know, many of our projects are very focused on work in clinical settings, and that puts people in direct harm's way. And so what we were wondering is, has anyone looked at the programmatic aspects of these projects and thought of new ways to keep the activities moving forward? Because as we know, we're hearing mixed messages from our funders. One is, yes, we want you to protect yourself, and we would like this work to continue, and you're still responsible for meeting your targets. So I think we have a good sense of how, you know, how people need to protect themselves from the virus in a clinical setting. It's just, you know, has there, you know, have we looked at ways to provide the personal protective equipment? Are there ways to move some of the clinic-based work to a more remote approach? Do we have, you know, tips for spacing people in lines or scheduling people to get services in a way that keeps both staff and beneficiaries safe? That was the kind of thing, if anyone has already developed some of that specifically for COVID-19. That's what I was hoping.
Another question we have while we still try to unmute Richard. Two questions that are similar. What are organizations doing in terms of policy to give staff time off if needed, if they are unable to work from home? And are you getting requests from employees who want to work on reduced schedule, i.e. less than 40 hours a week? How is your organization responding? I'm sure that's an issue for everybody.
Catherine, I just had a slight interruption from the from a work at home circumstance. Could you repeat the question?
Certainly.
I think I could answer
It's
that.
two questions rolled into one. What are organizations doing in terms of policy to give staff time off if needed, if they are unable to work from home? And are you getting requests from employees who want to work on reduced schedule, i.e. less than 40 hours a week? How is your organization responding?
So, I think every organization has some functions that cannot be performed from home. So certainly DAI has some of those functions. It could be, a receptionist, say, or a mailroom employee, and same thing on projects, right? Like the drivers or people like that. For right now, those people are at home and they're coding their time differently. DAI is paying, full wages for those people. If this continues for a long time at the project level, we'll have to see what steps we might want to take. But usually the people who are not able to perform functions from home are the, ones at the lower end of the pay scale. So not the ones with the biggest impact. We have not seen requests to work reduced schedules, but really what that question to me is, if people are wanting to go to part-time, we would certainly be willing to consider part-time requests, as long as it's not, some utterly critical position where we really need them full-time. Hope that answers the questions.
Thanks, Sarah. Does anybody else have anything to add? Any other organizations doing things differently?
Yeah, I think I responded on the chat for some of the others, but at Chemonics, we did enact an emergency sick leave policy last week, just to be extended for up to 5 days during times of health crises or pandemics that can be extended should a situation, be prolonged. But we did think that was important, especially for people who may be tending to sick family members or have things evolve as this goes on. I think, like many of the others, we're also doing it similar to what Susan mentioned in terms of coding time different for those that can't work a full day if their functions don't allow it. And we're also really trying to encourage to just right now do the best they can within the given hours in the day. There's 24 of them. I don't expect people to work all of them. But if it's easier for some people to work from 5 to 7 because they have little kids running around, then they should do so. So I think we're just trying to be as flexible and also pulse check and learn from people in the process.
I might just jump in right there to say that every company's policy is different on, how sick leave is done. So for people listening on the call, the way Chemonics handles its leave is different from the way DAI or APT or FHI does. So, each one of us might be taking different steps within the policies of our sick leave or annual leave or whatever it is.
Thank you very much. We had a question that I didn't address earlier, which is what actions are being taken to ensure that our organizations, both large and small, profit and nonprofit, are able to benefit from the relief packages now being considered by Congress. SID-Washington is not directly involved in that. I think Interaction and PSC and some other of the advocacy groups are probably more involved in that, but we'll find out about that and certainly convey information to you all. But I wonder if any of our speakers has any information on that issue. That's a good one, and we will try to get more information out on that. Richard Parker has unmuted his phone, we think. So let's quickly hear from Richard from USAID, if we can.
Actually, you unmuted me, so.
I didn't, but I'll take credit for it. Thank you.
So thank you, Catherine, and thanks for inviting me to come on, and thank everyone on the phone for your organizations and all the work that you're doing in partnership with us around the world during this time. Just a couple of quick remarks, really. Our main goals here at AID right now are protecting the safety and health security of our global workforce, working to continue our mission across the world in our programming, and then also to support partner countries and how they're responding. You may have heard that we've stood up an internal task force here that's being run by Dr. Ken Staley, who is the executive director of the President's Malaria Initiative that I'm sure many of you know. And Ken's doing a bang-up job really getting that started. He actually had previously worked at the NSC on pandemic response, so he's a great person to be able to have in charge of that. So we're in constant communication with our global workforce and trying to be in better communication with you guys. I know it was mentioned earlier about the acquisition assistance messages and things that went out at the end of last week, and I know both Catherine and Christine have mentioned the call tomorrow that PSC is helping to coordinate with OAAs to answer a lot of your questions on that. As far as like people that you normally communicate with at USAID, we are on a telework status for USAID. We have probably well over 90% of our folks who are teleworking right now in DC, and a great number of our missions are doing that as well. We were doing a test run of it yesterday, and it went really well, and just given a lot of the guidance that we're getting from the White House, we wanted to make sure that we're doing telework really for the foreseeable future with it, and it seems to be working well. Our CIO has had a lot of tools in the that he's been working on for a long time. He said we finally got to take the Mercedes out of the garage and take it for a spin. So, and everybody seems to be doing well from a telework perspective. As far as a lot of our work that we're doing, we're working directly with governments, multilateral organizations, of course, many of you and your organizations as well, on how to combat this on the ground. We have about $37 million that have been committed so far. The Secretary will most likely be announcing some additional monies probably in the next half hour or so from the State Department podium. And one of the things that we're really doing is trying to work with health authorities and other countries to really strengthen our capacity to be able to manage the outbreaks on the ground. A lot of the work that we've done really over the past 10 years with the Global Health Security Agenda has really helped to pave the way for that. We also, as you probably have seen in the supplemental package, state and AID both received $1.2 billion for the response. 965 million of that is specifically for aid programs across several of our accounts. The report back to Congress on what our plans are for that funding and how we're really going to tackle this was due 15 days after enactment, so that'll be the end of this week. And so we're working as quickly as we can on putting some of those plans together so we can submit those back to the Hill for approval there. Several of the pillars that around that funding will be to prevent and prepare for and really respond and bolster the health systems, as I mentioned earlier. Another tranche of it will be really responding to it from a humanitarian perspective as well, and with the consequences that we'll see on the humanitarian side. And then another tranche of it is really how do we prepare for, mitigate, and address other things that might come up from an economic or security or stabilization perspective with the COVID-19 pandemic that we're seeing now. So those are just a couple of quick remarks. I'm happy to take a few questions. Again, though, on the Office of Acquisition and Assistance will be on the call tomorrow to answer any specific contracting questions and things that you may have, but happy to take anything else that you may have. So thanks again, Catherine, for having me on.
Thank you, Richard. And if anybody doesn't have the information for the USAID call tomorrow, you can just contact us at SID and we can get that to you, or you can obviously contact USAID. I'm not sure if we have time actually for any questions specifically for you, Richard, because I think people are starting to peel off. I know everybody's got really tightly scheduled days, but that was extremely helpful. We have a number of questions we did not get to. We will do our best to try to respond to those afterwards. Just quickly, I wanted Sarah to maybe do a very, very brief wrap up.
Sure, happy to. So I think that was a useful call, and just to do a quick wrap up, I feel like we heard on five topics at this call. So most companies are working on business continuity plans. Those continuity plans are different from headquarters office to headquarters office to project office to project office. Each one has to be tailored. We're all working on striking that balance between what is in the best interest of safe staff safety and what it is that some, very concerned staff want to be doing. Number 3, we heard quite a few practical steps for home office leadership, project leaders. We heard about the online Humentum course on allowable spending. Number 4, there was, a number of us alluded or outright discussed the difficulty of taking blanket measures. Not just for us, but also for USAID. It really doesn't make sense to have, blanket policies on a lot of issues.
Sarah, can you turn your video off maybe, because you're getting stuck? Can anybody hear Sarah? Okay.
No.
All right. Well, I apologize so much for the technical issues. We're all learning how to use these platforms in this way. And I think just the high demand on platforms like Zoom is difficult. I appreciate your patience. We'll get better and better with it. Thank you all so much for your time. I'm sure this will be continued. And again, we will post the recording of this on our website, and we'll be in touch with some follow-up. Thank you, everybody, very, very much for your time.